Emergency Services. Tell me exactly what happened.
I've given my baby some mashed potato for dinner. I think he's having an allergic reaction.
All right, so is he completely alert?
He's just being really jittery, shaky. He's got a rash on his face and under his chin and on his hands.
An allergic reaction can quickly develop into life-threatening anaphylaxis, where airways swell up and close over.
Okay, so any difficulty breathing?
I think he might be. I don't know. Oh my God. I'm so scared.
RC139, receive cover.
Best work buddies Mike and Eamon are closest to the job.
This poor bugger is having an allergic reaction. He's got a rash, red and raised. He's had mashed potato for the first time, and he's very fidgety.
Anytime I get dispatched to a sick-sounding baby, my heart starts to race. These patients are so little and so fragile. It could be life-threatening.
Heavy traffic.
All right, lane 1, stop. Lane 2, stop. Lane 3, stop.
As the team battles to get there, the call taker does her best to keep the young mum calm.
I know it's scary. I'll stay on the phone with you until the paramedics are there to look after him, okay?
Oh my God. Should I look for the ambulance?
Not yet, just stay there.
Yeah, we've got some updates coming through.
Mashed potato, had cow's milk in it, which the patient hasn't had before. Rash seems to be going down.
Oh, we're just about on this, mate. It's never a nice feeling going to a really sick kid. We always say when we're treating a paediatric, we're actually treating 2 patients or 3, because we've got to look after the parents as well.
Hello. What's your name?
Cat.
Hello, Cat.
We arrive and see mum's out the front with her little baby, and she's understandably really distraught. So we've just got to get them in the ambulance and assess, find out what's going on.
Who's this little one?
Leo.
Leo. Do you want to bring him up into the ambulance?
Don't you love this
I hate
intersection?
This intersection.
As dusk falls in Melbourne, Amanda and Leonard have teamed up for a night shift. But peak hour traffic has them both on edge as they head lights and sirens to a Code 1 case.
So, Amanda, we're going to a 72-year-old male who's complaining of pain in chest.
Yeah.
Doesn't have any aspirin on him.
As soon as I hear 72-year-old with chest pain, the first thing that comes to mind is a possible heart attack. Cardiovascular disease is the biggest killer in Australia. And when we're talking about people in their 70s, it's an even higher risk.
Knock, knock, ambulance. Very dark in here. You in here, sir?
Is there some lights?
Can't see a single thing. There we go. Hello?
The team arrives to find their patient huddled under a quilt in his bed.
What's your name?
Ravi.
Tell us what's happening today.
Chest pain.
And when did this chest pain start?
A couple of hours ago.
And what were you doing when the chest pain started?
I was watching playing IPL cricket.
Watching IPL cricket?
Yeah.
Were you getting overly excited at the cricket? No. So you're watching cricket, and the pain started suddenly, or did it gradually start?
Started from my left side, and then it came in middle of my...
Okay. And right now, is it just in the middle?
Yeah.
Does it go anywhere else at the moment? Is it
Back.
your back? Okay.
Their first priority is to run an ECG test and assess exactly what's going on with 72-year-old Ravi's heart.
From what Ravi is describing, he has the classic symptoms of a heart attack. Left-sided chest pain radiating into his back. We need to be treating this really seriously.
Let's get you up into the ambulance, okay?
Mike and Eamon are with young mum Kat, whose baby's had a serious allergic reaction.
We'll take care of you guys.
You nurse him on the bed and we're going to give him the once-over, okay?
Kat watched in horror as a rash spread across baby Leo's face and hands.
Hi.
So, Kat, what happened with Leo?
I was having mashed potatoes, so I just sort of gave him like a taste. And just like this rash under here.
Got a little rash there, yeah.
Like it just got so inflamed. It was like all over his eyes, over his head.
And did he have any other sort of symptoms at the time?
He was like going like this.
Like shaking a little bit?
He was like going like that.
Okay, all right.
We need to assess if this is an anaphylactic reaction. Leo might look okay, But with any allergic reaction, it's so hard to know when it's at its peak or whether it's sort of just coming to an end. You can't let your guard down.
Hi.
Oh, hey, little man.
Hello.
Yeah, hi.
I'm Mike. Sorry, I'll be doing all the paperwork for you guys while
Hey,
Eamon pokes himself
Well, I
in the
poke myself in the arm with the stethoscope. I know, man.
eye. Very cute.
If Leo's allergy is still unfolding, his condition could quickly deteriorate.
Signs of a serious allergy or anaphylaxis are things like trouble breathing, tummy pains, vomiting, diarrhea, a skin rash that blows up like big blotches, and the really concerning one are if the patient collapses or is unconscious.
My chicken, sorry. 37 zip.
Excellent.
All right. His lungs sound nice and clear. I'm not concerned that he's having any sort of anaphylactic reaction. I can certainly see he's got that little bit of a rash there, and that may be a mild reaction to something that he's had. All right, and he's had potatoes for the first time. There's a bit of milk in the potatoes. Okay.
It looks like Leo's symptoms have passed, but he'll need to be watched closely in the coming hours.
At the end of the day, Leo has tiny little airways that don't have the ability to compensate for any sort of swelling or compromise. So he's just not safe to be left home. He needs to go up to the hospital.
Can I just get like his baby bag?
Yeah, absolutely.
I reckon Eamon will have a cuddle during that time.
Okay, you want to hang out with me?
Now that all the hard work's out of the way, I notice Eamon, he's having a little bit of a good time with young Leo.
All right, it's me and you, mate.
How do you get the good part of the job?
Okay, good.
Here I am, slaving away.
Can you say, Eamon? Eamon? I might get getting a bit clucky. Hi, little chicken.
Might be.
Hi, little chicken.
Leo is a very cute baby. If I had ovaries, they would be exploding.
Oh, jeez. You are clucky. Eamon and I definitely give each other a bit of a hard time, but I'm thinking he's actually pretty good at this.
Look at your little...
Oh, there he goes. Maybe I spoke too soon.
This is chaos.
At first, Leo and I were getting on like a house on fire, and now he's turned on me.
What's wrong, buddy? We went late like 2 minutes ago.
I'm starting to think that maybe I can wait a few more years for kids.
I don't know if my singing's making it worse.
It's definitely making it worse, mate.
Oh, buddy. It's okay. It's okay.
Ravi, if you could rate the pain right now, that heaviness, out of 10, what would you say the pain is right now?
8.
8.
Leonard and Amanda now have the results of 72-year-old Ravi's ECG. He's called them with chest pains, terrified he could be having a heart attack.
There's a little bit of T-wave depression in AVR.
Yeah.
Other than that, it looks pretty normal.
So far, there's no obvious cause for concern, but Ravi isn't exactly reassured.
I don't know. What are you guys talking?
We're just trying to work out.
Basically, we've just said nothing looks too bad, but you need to go to hospital. Okay?
When we conduct an ECG on Ravi, it's not indicating that he's having a heart attack. But at the same time, the results are never definitive. We still need to get a blood test at hospital.
I'm losing myself now.
No, you're not. You're all right, darling. It's okay.
It's time for me to go.
No way. We're going
This
to
is
talk about the
nothing.
IPL. You got to watch that first.
When patients start to talk about death or that they could die at any moment, it's a really tricky situation. You don't want to lie to them and say that there's no chance of ever dying because patients can see through that.
I just cooked something, I watered the plant, and just lie down and why did I get this pain?
So you need to balance it. You need to take a realistic approach, but you also need to just be genuine, calm, and most importantly, distract them.
I reckon a lot of people get chest pain when they do housework.
But until Ravi is checked over at hospital, a serious cardiac event can't be ruled out.
Now, what we'll do is we're going to get you on a wheelchair just because I don't want to put any extra pressure on your heart.
Oh, man. That is an awesome cry.
I know.
Eamon and Mike are preparing to bring baby Leo to hospital after a worrying allergic reaction.
Good strong cry. That is textbook good strong cry.
While young mum Kat is organising the baby bag, they're doing their best to entertain the 5-month-old without her.
Oh, buddy. 2 paramedics and a little baby. Where's Mum? Help.
There we go. Oh, here we go. Most important person, come on through. What's this? Yeah! Excellent.
Leo will need further testing in hospital, but it looks like he may have reacted to some cow's milk.
We're not going to try things at dinner tonight. Anymore? No, we're not.
Once the doctors reviewed him, they may refer him on to a specialist, but ultimately you've got to try these things. They're going to get exposed to all sorts of foods.
Kat's trialled her baby on some new foods, and then she's done the right thing in keeping an eye on him just to see if he has any reactions. And it looks like he has today, and she's needed to call the ambulance. So Kat's done a great job.
All right, little Leo.
While Eamon must now wrench himself away from his favourite patient of the day.
Hi.
Leo will be kept under close observation in hospital.
Well, we're just going to head down this way, please.
What's all this, Leo?
He was so cute.
He was pretty cute, I have to give him that. I knew better than to offer to hold him because I knew you weren't going to give him that.
I was never going to let you.
You're a cuddle hog. Every baby we go to.
But he was just such a little chicken.
Oof.
Nah, cute. I think I am getting clucky.
I'm saying this as your friend. Buy condoms.
You people do a wonderful job.
We try.
Aw, thanks, Ravi.
Leonard and Amanda are preparing to take an anxious 72-year-old Ravi to hospital for checks on his heart.
I'm telling you the truth.
Oh, that's what we like to hear.
You guys are lifesaver.
I appreciate that, mate. And now I feel really bad because I'm about to give you a tablet that might give you a headache now. So...
Leonard's been doing his best to distract Ravi, who's fearing the worst.
I'll tuck you in. I'll keep you covered up. I know you're a bit cold before.
Leonard likes to put out this persona that he's this very clinically minded person. Now, all it takes is a small scratch to the surface for anyone to know that he is such a nice, caring man.
Ravi, your heart on our monitor looks okay, all right? But basically, we can really only see obvious type heart attacks, all right?
I always respect paramedics more than the doctors.
Oh, more than the doctors?
Yeah, because you are the first people who come immediately to save lives.
We do our best, yeah.
It was pretty clear that Ravi was a fan of paramedics, and I like that kind of compliments. But as a paramedic, I'm used to doing all the questions, I'm used to doing all the history taking, and I can't say I'm the most affectionate person. So it just catches me off guard a little bit when Ravi starts to open up.
Can you hold my hand for a minute?
I can hold your hand. You're a bit scared?
I'm 72 years. I have 2 daughters. They are living in London.
Living in London. But you're a good man, Ravi. You're a good man. If there's anything that this job has taught me, it's talk to your family as much as you can.
Yeah.
I know it's hard with your daughters overseas.
So I'm asking Ravi about his personal life, and it becomes apparent to me that he's quite a lonely person.
You still got the pain at the moment?
Yeah.
Has it improved a little bit? You look more comfortable talking to me.
Yeah, I tried to get rid of my pain, talking.
Just talking.
I really hope that Ravi will be okay. But with chest pain, it can be serious, and sometimes you just don't know. I can only imagine that he's scared, and that's completely normal.
I can see you're a fighter. I think you're going to stay around for a lot longer. He was a really nice guy.
He was nice.
And
He
really
liked
appreciative. Well, I think he was just appreciative of the uniform of the service. I know you're thinking that patients like me, but
They do like you.
I can't take the credit.
Who else is going to hold their hand in the back clinic?
You would have held his hand.
Of course they would have. When a patient says, can I hold your hand, as if you're ever going to say no.
Are you saying that I'm a nice guy?
You are nicer than you let everyone believe. You just want to be a hard ass.
I do.
You're not. And I keep calling you out on it.
I know. Damn you. Why do you have to know the real man?
If you said tomorrow that we were getting the band back together at Micro 11, I would be all over that.
Absolutely.
Veterans Doddsy and Glenice are just starting their shift and wandering down memory lane.
And how many years were we there together?
Probably about 7 or 8 years. The funny part about that was 16 years ago, though.
I know.
Me and Glenice are both Micah team managers, so we've both been on intensive care units for a long time.
Nothing's changed, except I'm better looking.
Well, so am I. But
I
then,
would have thought you're way thinner.
than I was then.
Yeah.
Oh, I love you. I do.
When I got onto Micah, Glenice was one of my training instructors, and I just fell in love with Glenice. She's like my big sister, my ambulance crush, as I explained her to be.
Riding with you is good for my soul.
Absolutely.
Our conversations might be blue, our humour might be black, but the days I run with Doddsy are gold.
Absolutely.
But the intensive care team's day is about to get busy. A call is coming in from the worried family members of a 64-year-old man.
Tell me exactly what happened.
My son-in-law is on the bed. He's borderline non-responsive. He can't get up.
Is he conscious or unconscious?
I'm not sure.
Can you get any response from him?
Bruce? No.
So is he awake?
He's in and out. He's got emphysema.
Doddsy and Glenice are one of 2 teams sent to help the man who is critically ill with a history of lung disease.
So we've got a man, short of breath, came through as unconscious. Unconscious and shortness of breath often don't go hand in hand, and when they do go hand in hand, we know they're very sick.
The other crew has just arrived at the job and has a worrying update.
Currently heart rate 120, respiratory volume 30. Stats were initially 50%.
The most concerning thing is his oxygen saturation's around 50. For most normal people walking around, they're usually 97, 98, 99, if they're lucky 100. So that tells us that his lungs aren't working properly. He's also got a fast heart rate. These are things that can lead to death if they're not treated well.
Hi, guys. I'm Glenice. G'day, mate.
Bruce.
Bruce. All right. How you going, Bruce? How you feeling?
At Melbourne's busiest air ambulance base, Flight Paramedic Ray has just been called to help a man with potentially devastating burns.
What are we headed for, Ray? House fire.
So in regards to this patient, our immediate concerns are airway burns. Have they burnt to their airway or have they inhaled any significant amount of toxic smoke?
Are we expecting them to be at the footy field or?
Probably.
The chopper usually attends remote jobs in country Victoria, but this patient is so sick, it's a call to the suburbs.
Urban environments are well serviced by road ambulances, but burns are a time-critical case. In traffic, it can take an enormous amount of time, way more than we'd like to.
But landing in built-up areas isn't easy.
Yep, that's the oval.
The nice light brown ones.
Yep.
It takes careful manoeuvring to get the team down on a local footy field.
Speed forward, 5. Left 10. Left 5. Left 3, 2, 1. Position's good. Clear down. Thanks, mate.
Ray's patient is already with a road crew who are worried about his airways.
Our major concern is the windpipe closing over. So in the worst possible scenario, it can close over completely. You can't breathe. How you doing? What's going on?
The house on fire today and managed to get himself out, unsure how long he was actually in the fire.
Yep.
Partial thickness burns to his face, sooty nose, sooty tongue, sore throat.
Yep.
The man's been given pain relief, but he's still distressed.
What's he had analgesia?
So he's had 200 micrograms of fentanyl and 20 grams of ketamine.
So on handover, I can see he's obviously burnt to his face, into his arms, and the patient's not happy. He's really screaming out. He's impossible to assess properly. He's really, really agitated. Lots can go wrong.
Can we put that SATS probe on the other hand?
Absolutely. Here's your hand, Bruce.
Glennis and Doddsy are with a desperately sick emphysema patient, Bruce.
Dexamethasone.
Okay. So, Dex, you've got a flush.
Yep.
His oxygen levels are so low, he needs a continuous supply of drugs just to keep him alive.
Bruce, love, I'm going to sit you forward. I want to have a listen to that chest, mate.
So Glenice, after listening to Bruce's chest, understands that he's got pus in the bottom of his lungs.
So 2 weeks ago was discharged from Maroondah in there with the chest infection.
Yes. Sent home with antibiotics?
He finished antibiotics while he was there.
Yep.
Bruce has had a recent stay in hospital for a chest infection. So he's been treated for that, but it's not completely fixed.
Hi, guys. How was he last night?
Well, he worked till nearly 1 o'clock.
What does he do?
He was driving the emergency bus.
So you tried to rouse him from about 12?
Well,
couldn't get him up, couldn't get him moving. How's his cough been the last couple of days? Rattly? Shocking? Okay, yep. Bruce has been in hospital for a week with a serious chest infection. So on his first day out, he drives the community bus till 1 a.m. in the morning. All the good work that's been done in that week in hospital has been completely undone by him doing so much work overnight. Your eyes are a bit puffy, mate. Are they normally that puffy?
No.
No?
Bruce has pushed himself too hard and needs to be taken urgently to intensive care.
We're going to take you to hospital. You're very sleepy and you're not breathing well, so I'm not leaving you at home.
But moving him will put more pressure on his already failing lungs.
Bruce, swing your legs around.
Let's swing your pegs, old mate. There we go. Good work, buddy.
Poor Bruce, he's really in a bad way. Only 12 hours ago, he was driving the community bus around, and now he's the one in need of help. We've got a very sick man on our hands, and we need to get him to hospital very quickly.
All right, I'll get you moving, mate.
You're right, mate. You're right.
Flight paramedic Ray is struggling to examine his agitated patient. The man could have suffered life-threatening airway burns after escaping a house fire.
How's it go bad?
You can't go back.
The house is burnt. Can't go back.
Let's roll. 10 minutes flight time, mate.
Yeah.
We can be there before we can do anything else.
Yeah, cool.
And load it on. Good to go. Playing around on scene increases his chance for a complication, and it really means I have to sit there and intubate and put a tube into his throat. I'd rather take him to the Alfred. They've got anaesthetist to intubate the patient. They've got ENT surgeons to have a proper look with the proper equipment. So I basically need to get him in a helicopter. I need to get him comfortable and I need to get him settled.
Settle back. You gotta stay still. You're in the helicopter.
No. But Ray's patient is so agitated, it could be a risk to their safety.
Try and keep the mask on your face.
We don't want to be wrestling people in the back of helicopters. It's far from ideal. It has potential to bring the aircraft down. All right, good to go there.
Ray ups the man's medication to keep him calm. But the next 10 minutes will be critical.
You can't afford an out-of-control patient in an aircraft. You just can't. You have to make sure we have the situation pretty well contained before taking off. Have you go down feet first?
You just roll it over and we'll just guide it down.
Glennis and Doddsy are rushing Bruce to intensive care with his ex-wife, Barbara.
We got him?
They're worried the emphysema sufferer has a relapsed chest infection.
Bruce comes across as a stoic, hard sort of bloke, so probably doesn't identify within himself actually how sick he is. Probably thinks, I'll be fine, I can do the things I want to do. But Bruce isn't Superman, and these things have led to him being unwell again.
Bruce, I'm going to listen to your chest again, so I'm just going to hold you up
Glenice is urgently treating Bruce with a constant supply of medication, but his condition is precarious.
Having a roll?
Yes, please. All right, Bruce, let's give you something else to make you breathe a bit better, mate.
Anything you need, Glennie?
We're quite hypertensive.
What's his blood pressure?
180 on 95. One of the concerning things we get in the back of the ambulance is that Bruce's blood pressure is rising. Bruce, your tummy is very full today. Is that normal for you to be that tight? Bruce? Bruce, open your eyes for me, love. Let's push through, Doddsy.
I am, love. I'm stuck right in the middle. I can't move.
Bruce has got a number of things happening. He's got fluid retention within his body, and we can see that in his very, very tight abdomen. And that's a problem because some of that fluid is backlogging into his lungs. Yeah, we're quite tacky, a little bit hypertensive. Barbara, Bruce has got a really, really tight tummy.
Yeah.
Tight as a drum. Would it normally be that tight?
No.
No.
Fluid retention is a sign Bruce has heart failure on top of his already compromised lungs. But they've got him to the emergency department just in time.
Bruce, we're at the hospital now, mate. These jobs constantly change, so we're always reassessing and thinking what's going on. But that's what we're trained to do. Let's get you inside, Bruce. Bruce is very sick. He's probably one of the sickest patients we will see in a long time. So we're doing really high complex skills, really high clinical judgment, decision-making. They're the jobs we train for, they're the jobs I think we do well, and they're the jobs that keep us out of an office and keep us inside that truck. And that's what floats my boat after 27 years in this job.
Flight paramedic Ray is now on his way to hospital with his agitated burns patient. The man has been impossible to assess, and Ray is working hard to keep him calm.
Sit back. Good man.
It's far from ideal. I'd rather have a patient cooperative and involved in their care plan, let me know what they need and tell them what I'm going to do. But he's too agitated and he's too difficult to manage to basically allow proper burns care.
Directly from the office. This patient's a bit agitated, combination of pain. So we'll see you on the pad in about 5 minutes and just probably need some extra set of hands up there if we can.
Specialists at Melbourne's Alfred Hospital are standing by to sedate the man and fully assess any damage to his airways.
Down, brother. There we go. Set right for landing. And set the back next.
He'll also need extensive treatment for burns to the face and hands.
All right, couple of bumps come out. Yeah, good my side.
He's got some challenges ahead in how he manages those burns. They're in a sensitive area, they're in quite a cosmetic area. No one wants a burnt face. They're going to require some ongoing care.
All right, let's go and see the doctors, okay?
Next day, Doddsy's back on night shift, this time as a single responder. He's on his way to a terrified mum.
Tell me exactly what happened.
My 2.5-month-old baby, she's not breathing properly. She shut her mouth and sometimes she holds her breath.
Does she have difficulty crying between breaths?
Yes.
Breathing difficulties in babies can quickly become deadly. Doddsy is on high alert.
She's 10 weeks old. Kids are quite vulnerable, so it's a completely different ballgame.
Response 99, I'm just arriving.
Particularly being a dad and having kids myself, the anxiety levels get a little high as well. No one likes a sick child.
Hi.
You're shorter than Rissy, aren't you?
Yeah, by like 2 or 3 inches.
Okay, but that's not much.
It's a quiet start to Nat and Leonard's shift. They're discussing the politics of women who are taller than their partners.
It took me a while to kind of, I suppose, accept that fact. And for Riss, it was even harder to accept it. She could not wear high heels, ever.
Yeah.
One day she came home from work, she wore high heels,
and I was on like level with her boobs.
I bet you didn't complain, though.
Oh, it wasn't a bad view, but I mean,
That's
like,
right.
you know.
But the small talk is quickly put on hold as a call comes in from a woman in desperate need of their help.
So we're just being dispatched code 1 to a 40-year-old female who has chest pain and is short of breath.
Okay.
She's had a couple heart surgeries a few years ago. Patient stating she's having another surgery soon for palpitations. So there is a cardiac history.
Yep.
The woman has atrial fibrillation, or AF, a condition causing a rapid, irregular heartbeat.
When I'm told that a patient has a fast heart, the first thing that I think about is, well, how fast and potentially what rhythm, because there are some rhythms of the heart that can actually kill.
Hello. Who's the patient? Your wife?
Yeah, my wife.
Your wife. What's your wife's name?
Nari.
Nari?
Yeah.
Nari. Yes. My name's Leonard. Where am I going?
Thank you.
Over here. Do you want to tell me what's happening tonight, Nari?
I feel like my chest is very sore.
Sore.
Yeah, and I got short breath.
Do you have palpitations right now?
It go up and down, up and down.
Up and down.
You know what I mean? When I have palpitation, I feel faint.
Faint, but not pain. So tonight's pain, and that's the scary and different thing.
So Nari has a history of AF. What this means is that it's not abnormal for Nari to experience palpitations, but tonight is the first time that she's ever had chest pain associated with these palpitations. That concerns me.
What I would like to do is pop a few more sticky dots on your chest, if that's okay. And that will give me a better picture of what's happening.
Leonard urgently runs an ECG test to see what's causing Nari's pain.
Do you feel like you're going to faint at all?
Yeah.
Yeah, you've been a bit dizzy?
The symptoms that Nari is describing to me are setting off alarm bells in my mind.
Nice and still for the moment.
Okay, keep still.
I'm thinking, are you having chest pain because your heart's beating too quickly? Or are you having chest pain because tonight you're having a heart attack? Or potentially both?
Hello. Hello, sweetheart.
Doddsy's just arrived to help a panicked mother whose baby's been having breathing difficulties.
What was your name?
My name is Param.
So what's happened tonight, Param?
She held her breath. It was like choking. Yeah.
Okay.
But now she's.
I know, she looks fantastic. Why don't you sit down for me and I'll just have a little listen to her chest and see how that sounds. Even though Bubs looks quite well and is breathing, I still want to make sure that everything's okay. Param's worried something abnormal has happened to her child and she needs that to be investigated to relieve her anxiety. Hi. Hi. What's your doll's name?
But while Doddsy makes his checks on baby Amreen, big sister Amber's determined to get in on the act.
I haven't.
No, that's okay. Oh, no, sweetheart. I'm just going to listen for 2 seconds and then I'll have a look, okay? Okay. She's a little bit warm, isn't she? Okay, that sounds okay.
Whenever I feed her, when she throws, sometimes milk come from
So
her
she
mouth.
has reflux, a little bit of reflux, which is not uncommon.
Doddsy suspects Amreen's reflux could be affecting her breathing.
Why is she holding her breath then?
So because she might have a little bit of a plug in there. So when she like burps or coughs, or she might have a little bit of milk that's in there that she'll cough and part.
Okay.
Can I hold her?
Yep.
It's only natural to be concerned, but reflux is not uncommon. They're nice when they're this big. But I've been doing this for 20 plus years and one of my kids gets sick and I still do the home alone. Oh my God, what's going on with my children? And I have an understanding. So it's important to relieve some of that anxiety from Mum. Oh, sweetheart, I don't think she likes me very much. She's hanging on to my beard well, though. Let's go back to Mum.
While Doddsy is satisfied little Amreen is no longer in danger, he's taking the conservative approach and is recommending Param take her baby to hospital for further tests. Which means it's Amber's last chance to impress her visitor.
For her, this is like a circus. There's ambos, there's equipment that goes beep, there's strange people in the house, there's cars with flashing lights. She thinks this is the greatest day ever.
I'm coming, Cassie.
Nice and still for the moment.
Okay, keep still.
Across town, Leonard and Nat are still under pressure, waiting for the results of Nauri's ECG.
I'll have a good look at this.
She already suffers from a fast and irregular heartbeat. The test will show if she's also having a dangerous heart attack.
Okay. So apart from the fact it's a bit quick, there's nothing on the ECG that's really scaring me, but we can never be 100% sure.
Fortunately, it doesn't look like Nari's having a heart attack, but there are some irregularities going on and these need to be investigated in hospital.
I'll just pop the line in here. So obviously it's going to be a little bit of a sting.
Until Nauri's palpitations can be assessed by specialists, she's given pain relief and medication to take the pressure off her heart.
It's almost done.
But it's all too much for husband Leng, who lives in fear of his wife's terrifying condition.
I say you need to call ambulance because your palpitation is too high, you know. You can't breathe. The heart is important.
Pop it into your mouth and chew it up.
It's meant to taste like lemon.
She doesn't believe you.
No, I'm not a believable man. My wife doesn't believe me half the time.
Yep, chew it up.
She's very kind, lovely girl. I worry about her because I love her.
When you're ready, let's walk over there.
I'm scared to die.
So where are you from? What country?
Cambodia.
Cambodia.
You married?
I am, actually, yeah. I got married this year.
I've been married 23 years.
23 years. But how long did your husband take to propose?
I got arranged marriage.
An arranged marriage?
I met him about 2 weeks. Waiting.
I mean, it's very different, obviously, to the culture we have here. And I had 10 years of courting, and I still found it nerve-wracking to actually pop the question, and you got 2 weeks.
I can't imagine how nervous Nari must have been to get married to someone she knew for 2 weeks. It took me over 9 years just to pop the question, let alone to get married. She's got a lot more guts than me, I'll tell you that.
Okay, we'll take you in. Your husband's meeting us down here, okay?
Everyone has their own story, and in Nari's case, she's gone through so much in her life. Fingers crossed that what's happened tonight is nothing too serious and that it's just her palpitations that have been causing her pain.
There we go.
Bruce, swing your legs around. Don't swing your pegs, old mate.
It's now 6 weeks since community bus driver Bruce was rushed to hospital.
Bruce, open your eyes for me, love.
After a chest infection was confirmed, he was put on life support for 3 days, but is now back working night shifts on the bus. Ray's patient had everyone on high alert on the way to hospital. Doctors discovered he did have dangerous airway burns and had to place him in an induced coma and take over his breathing.
So tonight's pain, and that's the scary and different thing.
40-year-old Nauri was cleared of a heart attack, but needed urgent surgery for her palpitations.
Press harder. Use your muscle, man.
She's now safely back at home with her husband of 23 years, Leng.
I can do it for you.
Good boy. The doctor say that he's happy with the surgery. We're gonna let it heal. But I'm happy with my life. I'm happy with my parents that they choose a right man for me.
If anything happened to my wife, I feel sad the whole life. Because I love her, you know.
It's time for me to go.
72-year-old Ravi was terrified of dying. But after cardiac trouble was ruled out, he returned home to watch the cricket.
Can you hold my hand for a minute?
I can hold your hand.
Ravi is still very grateful for the care he received.
Oh, you trying to talk to Daddy?
As for Leonard, he's getting even more in touch with his softer side, with the help of new arrival, 10-week-old Levi.
Levi, sweetheart.
Leonard and wife Larissa are besotted.
He's a bundle of joy. I love him to bits.
See?
I'm essentially moving from a clinical paramedic perspective to an emotional husband and dad.
Let's change your nappy.
That freaks me out because it's completely new to me.
Hey, you're not going to wee on Daddy, are you, when your nappy's off?
Now I truly realise that life isn't just about me or us.
You're a good boy. Mummy and Daddy love you lots.
I would
give up all my sleep, all my food, all my hobbies and downtime to make Levi happy. You know, because when he's happy, I'm happy, we're happy.
Look at your little...
Oh, there he goes.
Baby Leo's start in life hasn't been quite as smooth as Levi's. Since recovering in hospital from a reaction to cow's milk, he's been diagnosed with an extreme allergy to both dairy and peanuts.
Don't look at me like that.
Oh, jeez.
As for Eamon...
You are clucky.
He did give in to his paternal instincts.
We'll go down to the park?
And got himself a baby that's just as cute as Leo.
Come on, Walter. Good boy. So, Walter is my golden retriever puppy, and he's 4 months old now. Come here. Hi. Hi. Oh, Walter is he's a ball of energy. He's a bit of a chick magnet, which is good. You're gonna be cute. Yeah. It's kind of crazy to think that in 4 short months you can just love a little ball of fluff so much. It's just... Yeah, good dog. Love him. That's awesome. Come a kiss. Give me a kiss.